Happy Monday, everyone. Today on NEDA Connections, we have award-winning researcher, teacher, and mentor, Dr. Bryn Austin. Dr. Austin has numerous professional affiliations and is joining us today as the immediate past president of the board of directors of the Academy for Eating Disorders and the director of the Strategic Training Initiative for the Prevention of Eating Disorders, also known as STRIPED, which is based at the Harvard T.H. Chan School of Public Health and Boston Children's Hospital. Welcome, Bryn. Thank you for joining us today to talk about this new report from STRIPED in collaboration with the Academy for Eating Disorders and Deloitte Access Economics.
Thank you for the invitation. I'm delighted to be here.
Absolutely. So for those of you at home that are hearing about this report for the first time, Bryn's going to get into some details in a little bit. But just for some background knowledge, this was a year-long collaboration that provides a critical new body of evidence on the devastating impact of eating disorders on individuals, families, and society. So Bryn, what are some of the most potent data to affect change that came out of this study?
Yeah, well, this won't surprise anyone in the audience, but we cannot stress enough with policymakers and key decision makers these points. Eating disorders are common, they are deadly, and they are costly. So eating disorders are much more common than most people realize, and they affect people of all genders, race, ethnicities, sexual orientations, body sizes, and ages. Nearly 30 million Americans, or almost 10% of the population, will have an eating disorder in their lifetime. Our report also showed eating disorders are among the most deadly of any mental health condition, killing over 10,000 Americans every year, or one person every 52 minutes. Now think about that. Every 52 minutes, someone's loved one needlessly dies from this preventable and treatable condition. And eating disorders are expensive, costing the U.S. economy almost $65 billion, that's billion, each year. For individuals and families, the impact is profound. Eating disorders cost individuals and loved ones nearly $24 billion per year. And loved ones provide on average 6 weeks of informal unpaid care each year.
Wow, those numbers are they're really something. A lot of it's what we already know, the 30 million affect Americans, but what are some of the outcomes of the study that surprised or shocked you?
Yeah, I was really surprised by how much employers are impacted by eating disorders. The numbers really have never been calculated in the US before. So if this is news to those of us who work in the field, you can bet that most employers have no idea. But employers and policymakers should take note. 3/4 of the total cost to our economy each year from eating disorders, or almost $50 billion, is productivity losses. And what that means is losses due to absenteeism, impaired work performance because of either illness or caring for an ill loved one, or premature death. The majority of people affected by an eating disorder are hit in the prime of their working years, which intensifies the impact on our economy and on employers.
And we discussed this offline. I think I'm going to move this question up because this data is it's hard to hear. And so we've heard from some members of the NEDA community that they've expressed concern that this study reinforces that belief that people with eating disorders are a burden. And, this is some of what the data is saying. So what would you say to the listeners who are feeling this way?
Let me just say this really clearly. An eating disorder is never somebody's fault. It is never somebody's fault to have an eating disorder. The responsibility lies in government and in our society to get people access to care, to reduce stigma. People should not be stigmatized for this condition. They should have access to care. It should be covered by health insurance, and it should be caught early, or better yet, even prevented. That's the responsibility of society. That's where, if there's any burden, it is the society needs to address that. And employers with health insurance, government health insurance, everybody has a right to being treated fairly, equitably, access to care. That's where we need the focus to be, not the pressure on individuals. People are already struggling enough because of these unfair conditions. As a society, we must address those now.
Yeah, it's really great that you're highlighting that it's not the individual's fault. It's not the individual's issue or being a burden, but really that our society needs to get its act together when it comes to eating disorders. And so you were talking about fair and equitable treatment. And so, especially given our current culture with Black Lives Matter, how does structural racism impact eating disorders among Blacks and people of color? And what were the study findings on the differences in access to care and treatment?
Yeah, these are tough times, and there's so much need out there. Our healthcare system is overwhelmed with the COVID pandemic, and too many people are getting shut out of care because of systemic inequities, particularly targeting Black and brown communities. And these inadequacies and inequities in our healthcare system have only been compounding the risk for people struggling with an eating disorder also in these difficult times. Eating disorders are really no different from other health conditions in this respect. Structural racism increases risk, it creates barriers to care, and it undermines the delivery of competent care by healthcare providers. Our report also makes it clear that there's major gaps in what we know and where we need more research done. We already know there are higher rates of eating disorders in some communities marginalized by race, ethnicity, sexual orientation, gender identity, body size, and other important identity groups. But how are structural racism and other structural oppressions in the U.S. contributing to the enormous cost of eating disorders in this country, and what can we do about it? This is where the research must take us next.
Yeah. And so what do you think has been the main barrier for preventing the medical community and society from realizing how serious and pervasive eating disorders are across the board?
Well, the misguided stereotypes that we've all heard about eating disorders are still alive and well, unfortunately, and they are as much a cause as a consequence of the gross underinvestment that our country makes in eating disorders. And I'll give you a few examples. In 2019, the National Institutes of Health, or NIH, awarded $44 million in research grants to eating disorders. But that is dwarfed by the $65 billion in financial losses that I just told you from our report that are happening every year in the U.S. economy. By comparison, we can look at Parkinson's disease, which is estimated to cost our economy around $52 billion per year, but received $224 million in research dollars in that same year in 2019. So by comparison. But people have said to me, well, we're not going to make decisions about all the health and research support around cost of the economy, where there's a lot of other considerations, like, for instance, the number of people affected by a condition. And absolutely, that's true. I completely agree. So let's look at some other numbers from NIH. In 2017, NIH funded research for Alzheimer's disease at roughly $239 per affected person in the U.S. They funded autism research at approximately $109 per affected person in the U.S. Schizophrenia at $69, but for eating disorders, they funded research at a meager $1 per affected person. I mean, clearly, there is a lot of room for improvement in the federal government's response and investment in eating disorders research.
Absolutely. And all of these conditions and illnesses are important to research as well. But we're talking about disparities, right? I mean, $1, what is that going to do? I mean, it does absolutely nothing. And so I know policy is a big piece of your work. And so why is it important for policymakers to care about the results, and what can they do immediately? Or what do they need to do immediately?
Oh, yeah, we know what they need to do. And let me describe a few things that we really want to see them step up and do. Our report offers a sobering reality check on the profound effect on social life and economic life because of eating disorders. And it's a cost that we know from other research, very new research, that you've even profiled on these series of interviews with NEDA. There's a cost that's very likely compounded by the COVID-19 pandemic. Yeah. But our report also points to many opportunities for action by policymakers. We always want to look for opportunities for improvement. So one, we need the federal government to evaluate and correct insurance gaps coverage in Medicaid and Medicare, TRICARE, Indian Health Service to ensure that comprehensive care is accessible for treatment for eating disorders for everyone having that kind of coverage. Two, we need the CDC, HRSA, and other federal agencies that run our country's vast and robust national public health monitoring system to add data collection on eating disorders. That's the only way we're going to be able to monitor how eating disorders are impacting our communities and where prevention is working or where screening is working. And on the topic of screening, we need routine screening for eating disorders in children and adults in primary care, schools, workplaces, and other settings. And finally, we need government and foundations to invest in research. We need to find cost-effective options for reducing the impact of eating disorders through better treatments and through better prevention and early intervention.
Yeah, really great tangible things that we need to be doing now. And so on the individual level, what can people do as advocates to impact change and spread the word?
Well, this is the part that gets really exciting when we just look outside the borders of the U.S. The report we released last month was the first of its kind for the United States, but it was not the first of its kind in the world. We are following in the footsteps of pioneers from Australia's Butterfly Foundation and the UK's Beat Charity, both of which commissioned comprehensive national economic reports for their own nation years ago. So then this year we decided to try to catch up in the United States. But the exciting part is that Butterfly Foundation in Australia was able to leverage the report and their findings along with a number of other advocates from the scientific community and other areas of the community. They leveraged that data from their report to secure 110 million Australian dollars from the federal government to expand their Medicaid coverage. So in November 2019, because of this advocacy, first the report and then the really savvy advocacy in Australia, Australians affected by eating disorders for the first time had comprehensive treatment plans and access to psychological and nutritional services on the level that they needed. Really comprehensive coverage for the first time. And because of the federal government's investment, that was because of the advocates' dogged pursuit of getting better access to care, it's estimated that roughly 30,000 people with eating disorders each year in Australia now have access to comprehensive care. So that's our model there, what they've achieved. Now in the U.S., the community has been sounding the alarms about the vast and unacceptable barriers to care for many, many years. NEDA and so many other community organizations and individuals, families have been doing this, sounding of the alarm. But policymakers and gatekeepers in the healthcare sector, they've taken some action, but their efforts really have been piecemeal and not nearly adequate, which I know everyone in your audience knows. Policymakers have told us they need to see the numbers first before they can take action. Well, now with our new report, whether those policymakers are moved by the $65 billion hit on our economy every year or by the life lost every 52 minutes, they have the numbers. Now is the time to act.
Absolutely. There's something compelling. I mean, there's many compelling things, but there's something that's got to resonate with each and every policymaker from this report. So thank you and your colleagues for doing this incredible work. And thank you, Bryn, for taking the time to join us for NEDA Connections and all of your important contributions to the field. So as we're wrapping up, would you like to plug any social media accounts for the various organizations that you're representing? And also, I know that there is a virtual briefing on this tomorrow, which we'll add a link in this caption afterwards for anybody that's interested in watching. But if you have any information on that as well, it would be great.
Yeah, well, thank you, Chelsea, for the opportunity to join you today and for all the work that NEDA has done and NEDA has done with many other organizations in the community. The report, people will be able to download the report from our website, the Stripe website, or the Academy for Eating Disorders website, or we have a one-page infographic. If you want to just get right to the point, go for the one-pager, and you will get the highlights there from the report. Striped, we're on social media, on Twitter. It's a Harvard Striped is our Twitter handle, Facebook, Instagram, LinkedIn, and AED, also Academy for Eating Disorders, same platforms. You can find us there, very active. I'm so glad you mentioned the briefing tomorrow, too. We're excited about that work being led by the Eating Disorders Coalition in Washington to address again, barriers to care, and this time with the elders in our communities and what we need to see government do to step up and make comprehensive access to nutrition care available for elders and others affected by eating disorders covered in Medicare. So keep an eye out for the details on how to log in for that tomorrow. It's afternoon, East Coast time, 2 to 3. We have the briefing will be up. A lot of wonderful speakers who'll be joining us, including Christine Pete from the National Center for Eating Excellence in Eating Disorders will be part of the briefing, which is sponsored by the Eating Disorders Coalition, working with a number of partners. So I hope to see many in the audience there tomorrow, too.
And Dr. Christine Pete and Dr. Cindy Bulick were on our NEDA Connections last Monday, so our community should be familiar with them. Well, again, thank you so much, and thank you for everyone at home that is listening. I hope that you too find this data to be encouraging despite the sad reality of what we've found. So thank you, Bryn, and thank you, everyone. Have a great day. Bye.
Thank you, Chelsea. Bye.